There is much that can be said by the president, governors, and even the media. But nothing can have a greater impact than the words of a doctor during a global health crisis like what exists with the coronavirus pandemic. The top health officials testified before the Senate, with Dr. Anthony Fauci, a member of the White House Coronavirus Task Force and the nation's top infectious disease specialist, predicting that reopening states would lead to suffering and death that could be avoided. There's not much anyone else can say to cancel that knowledge now that it's out of the barn. Fauci made these comments during the Senate hearing with both Democrat and Republican senators asking him questions. He and the other three witnesses and Chairman Lamar Alexander, RTN, of the Senate Health, Education, Labor, and Pensions Committee all appeared remotely, as they have each been in contact with people who had recently tested positive for COVID-19. The other three witnesses were Food and Drug Administration Commissioner Stephen Hahn, Centers for Disease Control and Prevention Director Robert Redfield, and Department of Health and Human Services Assistant Secretary Brett Giroir. If some areas, cities, states, or what have you, jump over those various checkpoints and prematurely open up without having the capability of being able to respond effectively and efficiently, my concern is that we will start to see little spikes that might turn into outbreaks, said Fauci when describing the dangers of states ignoring reopening guidelines. I have been very clear in my message to try, to the best extent possible, to go by the guidelines, which have been very well thought out and very well delineated. Giroir, who oversees the testing strategy in the United States, said the country could be performing up to 50 million tests a month by September. Yet, that would still be fewer than the 2 million to 3 million daily tests that are needed to ensure that it's safe to return to work. There was also a warning by the health officials of a possible surge in positive cases in the fall that could dangerously coincide with flu season. Donald Trump has said it will not be worse than what the nation is going through right now. Redfield said the U.S. will need a 5 to 10-fold increase in ability to conduct contact tracing by the fall. This would identify all the known contacts of a person who tests positive to prevent further infections. He warned that social distancing will have to remain at play for the next several months. Fauci also contradicted Trump's statements that the virus will disappear soon without a vaccine. The doctor said that is just not going to happen, adding, "It's a highly transmissible virus. It's likely there will be virus somewhere on this planet that will likely get back to us." Senator Mitt Romney, RUT, had harsh words for Giroir, accusing him of politicizing testing numbers. He said Giroir celebrated the fact that the nation is doing more tests per capita than South Korea while ignoring that they had a greater testing capacity than the US at the beginning of the pandemic. They also have only had 300 deaths. "I find our testing record nothing to celebrate whatsoever," said the senator. Senator Rand Paul, RKY, could have had the most worthwhile questions, as he himself was infected with COVID-19 a few months back but recovered. Yet, he chose during his time to tell Fauci he was not the end-all for decision-making during the pandemic. The senator believes school can reopen in the fall because the virus appears to be less dangerous for children. "It's not to say this isn't deadly, but really, outside of New England, we've had a relatively benign course for this virus nationwide," Paul said, which was an interesting comment with the US having a far higher number of positive cases than any other country. "And I think the one-size-fits-all, that we're going to have a national strategy and nobody is going to go to school, is kind of ridiculous. We really ought to be doing it school district by school district, and the power needs to be dispersed because people make wrong predictions." Fauci asked to respond, then said, "I've never made myself out to be the end-all." He added a warning that while the numbers show the pathogen is less dangerous to children than adults and the elderly, we don't know everything about this virus. He also made note of an occurrence of new cases of coronavirus-infected children presenting with a very strange inflammatory syndrome, then added, "I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions." Asked repeatedly whether better therapeutics and a vaccine will be available, Fauci indicated they would not be ready in the fall when schools reopen. The idea of having treatments available or a vaccine to facilitate re-entry of students into fall term would be something that would be a bit of a bridge too far, he testified. The drug that has shown some degree of efficacy was modest and in hospitalized patients only, he continued, referring to remdesivir. He also warned that the drug alone is not sufficient as a therapy. Senator Elizabeth Warren, DMA, asked Fauci whether COVID-19 is contained yet in the U.S. He said, "I think we are going in the right direction, but the right direction does not mean we have by any means total control of this outbreak.